Our next speaker is Tinrin Chu, who is a registered dietitian specializing in oncology nutrition. Tinrin, welcome.
Thank you. Thank you, Margaret. Thank you, everybody, and thank you for coming in tonight in the raining day. We really appreciate that. I think my session is pretty fun and easy, actually, because we can prevent the surgery, sometimes can prevent the chemotherapy or genetic things, but nutrition can certainly make life a little bit easier and better. Just gave you some of the research by American Institute of Cancer Research. Basically, I think we're talking about one of the biggest risk factors for endometrial cancer, for example, and breast cancer is body fat and the weight. So very convincing evidence, as you can see from the left-hand side column, is breast cancer, colorectal cancer, endometrial, esophageal, kidney, and possible suggestive evidence, very strong evidence will be ovarian and cervix as part of that. How are we keeping our body in check? A lot of people ask me. I think our weight just slowly and gradually creeping up, isn't it? Especially as we get older, and especially with all the convenience food, all the processed foods, and the holiday season, And I usually tell my patients, as long as you don't gain 1 single pound or just limit to half a pound of weight gain over the holiday season, consider yourself a success. And so, how do you keep your body weight? I think a lot of times is not to be obsessed by your weight. However, I think we just need to be a little bit more aware of it. What is really reasonable? I don't know if you're aware of that term. I know body mass index really is not absolute. A lot of people counter that. But we don't really have a practical or user-friendly measurement at present. So body mass index actually does apply to about 85% population, I would say. But this level does not apply to football player because of their muscle mass, okay, or very extreme athletic people. So BMI still is applicable. What I tell people, ideal, hopefully around 19 to 25. But interestingly is that right now, even BMI of 25, many people, if you walk on the street, people say, you're too thin. Or your neighbor, your family member may just say, you're too thin. Or if your BMI is 24, because average population, the weight is start increasing. Clothing store. Have you noticed the clothing store? Size 4, if you used to wear size 4, right now you have to shrink down to almost size 2 or size 0. Because size 4 literally is olden days size 6 or even 8. But by looking at the data, what is okay? A lot of people say, well, Tim and some of my colleagues would say, I feel more comfortable bringing our patients down to a BMI of 25. But as I was going through a lot of various data, I feel as long as a person doesn't go beyond 30, 28 will be pretty much a yellow zone by now. So I like most of my patients to keep it below 28. After 28, you start seeing all the risks start rising, okay? And not only just the cancer rate, but many other diseases. So reach for about 28 BMI. Hip and waist ratio probably will be the best, waist and hip ratio for men. Then today we're talking about GYN, so I'm going to focus on women. Hopefully your waistline will be less than 35 inches, or that ratio will be less than 0.8. Probably the best thing, just go on Google search, just type in BMI, and there's a chart you can chart yourself, and put in your weight and your height, then you'll know where your BMI stands. Normal, I'm highlighting here, overweight, when you're overweight is 20 up to 29, so you want to reach below 28, that will be the best. All right. So ways to keep your weight in check. Confucius, now I'm quoting Confucius, ever since I was little, we grew up drilled in our head, Confucius said this and that. So Confucius says, eat 75%, 70% full. Why is that? Now, many of the American public or public health also start talking about for weight management, just eat 70% full. I think a lot of times, holiday season, when we go to buffet, we eat about 150% full. Now, secondly, the best way, I really like the second one, is load up your vegetables with mostly vegetables. Okay, vegetables is very small amounts your starch, and about just a third portion will be your protein. Eat less fat, that's very easy, and also less hydrogenated fats and sweets and candy and sugar. Holiday season that's the biggest thing, challenge for all of us. Avoid simple sugar. I can't stress enough to all my patients is that eat your dessert afterwards, just like your mother said. If you haven't finished your fruits and vegetables, your main meal, try to stay away from your sweets. The sweets is never a replacement for the meal. You all know that. The last thing is you're drinking plenty of fluids and exercising. Exercising will help you burn a lot of calories. But one thing, last year with the GYN cancer, I think I asked one simple question. For 100 extra calories you consume, how much do you have to walk to burn that 100 calories off? Guess. I'll take any answer. About half? Okay, not bad. 20 minutes. 20 minutes, okay. My husband and I were walking, and usually my girlfriend and I, we usually run Lafayette Reservoir. A lot of times after that running, and then we'd go to Starbucks. My girlfriend would order whatever she wanted to order, plus a little pastry. I say you defeat entire purpose, right? Then the other day we're at Barnes & Noble, I guess, and my son was ordering, says, Mom, you really ought to try this delicious coffee, Starbucks coffee, holiday season. What do you have that? Gingerbread coffee, and the other one was, what do you call that, pumpkin spice or pumpkin pie, whatever that coffee. Do you know how many calories that thing is? That little thing? I never paid attention. That little thing, 300 calories. Right? So you better run through the entire Lafayette Reservoir. By 1 hour, you'll burn that 300. But no cookies, no cake to go with that. Not saying that you can't, but those are the ways to really kind of be a little bit more mindful. But to allude to why do we do a lot of fruits and vegetables to fill our plates, not only just to for the weight management purpose, but the other thing is that last year or 2 years ago, National Cancer Institute actually gave you a report, okay? Basically, headline is limited fruits and vegetable consumption is a cancer risk. People whose diet, what they notice that whose diet are rich in plant foods such as fruits and vegetables have a lower risk of many different types of cancer, but also they have very less likelihood to get diabetes, heart disease, and hypertension. But the added benefit is that it also helps them to control their weight. And guess how much you have to eat? I'm not sure you'll be able to see the last line. 4 to 13 servings of fruits and vegetables. And basically 2 to 5 servings of fruits and 2 to 8 servings of vegetables. And if you look at this thing, most of my patients, as well as physicians, say, I be darn, are you crazy? For 15, 20 years, a lot of oncologists think I was just nutcase coming from the Mars or from the moon. 13 servings. Where are you coming from? What planet are you coming from? Okay. Basically what we're saying is that if you really kind of imagine 4 servings, that is for pediatrics. If you have toddlers at home, you're 4 years old, 6 years old, pretty much they need about 4 if you're that little. But by the time we get older, genetic materials start mutating, right? Aging process kicks in, and body weight increases. Pollution will accumulate so much junk throughout lifespan. Amounts of fruits and vegetables to counter that is going to proportionally increasing. Okay, the larger we are, the bigger, the more portion we're gonna need. So the olden days, remember five campaign, right? 5 servings fruits and vegetables that was brought to the market back in 1990s. It really does not apply to health, to wellness, or to cancer prevention any longer. I think once we have that cancer diagnosis, that 5 servings, I really don't believe is enough. I'm going to explain a little bit more, is that when we look at a couple of studies, this is a nurse's study, okay, enrolled in about roughly about 67 nurses, and they're looking at many different health risks and stuff, okay. One of the things they're looking at is that, well, a couple of chemical compounds in fruits and vegetables that they're consuming. So they did a quartile. Basically, the nurses who ate higher amounts camphorol. Camphorol basically is one of the polyphenol compounds. They have about 40% lower risk of developing ovarian cancer. And the other ones are almost lutein family. These are the yellow family, yellow color family from your carrots, from your cabbage and peppers and those type of things. And have about 34% lower risk, okay? And these are basically just by we call the studies by looking at what they're eating. And the other study, camphorol, again, is from the non-herbal tea, is your green tea, from your kale, from broccoli. All these are cancer-fighting foods, all from that family. And the other study was a case control study conducted in China, believe it or not, was looking at carotenoids, okay? And this basically has about 265, I believe, ovarian cancer, and then compare with the 652 healthy women at the same age matched group, okay? What they were looking at is that does eating plenty phytochemicals coming from carotenoid foods actually reduce ovarian cancer risk, okay? Lo and behold, what they have found is that beta carotene, 61% lower risk. Again, what they are doing is a highest quartile versus the cancer risk. Highest quartile actually have about, of a beta carotene has 61% lower ovarian cancer, beta carotene 49%. And overall, total carotenoids will have had about 67% reduced lowered risk of ovarian cancer. And why am I bringing all these things up? There were actually a few slides, but I didn't want to bore you with all the graphs and all the charts, is that I'd rather see the colorful photos. But I'm just going to verbally give you some of the studies was that. There was a breast cancer study. UCLA, UC San Diego have always done a lot of nutrition recalls. And now we find that until we start looking at the ladies' serum, their carotenoids, then we really don't know their disease recurrence and risk recurrence as well as survival rate. So finally, Dr. Cheryl Rock from UC San Diego, I think published at least about 2 years ago now, literally looking at the carotenoid concentration with the breast women's survival rate as well as disease rate. Again, by the quartile, they see huge difference. Higher carotenoid concentration in the serum has the least disease recurrence as well as secondary cancer. And then we also look at the carotenoids. Why? Because carotenoids, by looking at people who have a high consumption carotenoids, that is huge. Fruits and vegetable kingdom give you yellow, orange, red, and the leafy green. Those colors is that if you are loading up your body with a huge amount of carotenoid, what does it mean? You're eating plenty of fruits and vegetables, right? That's a natural antioxidant. What does the antioxidant do? Protect your DNAs. And one of the studies is very interesting, I believe it was New York study, was by giving people the carotenoids, various different carotenoids. And actually, within 2 weeks, they start seeing the DNA damage, repairing the DNA damage. So it's really powerful. And I know a lot of times we talk about fruits and vegetables, really is not sexy. It's just a boring topic, okay? And we really don't need to have research to back it up. But I think what's very exciting right now is through the genomes, we start looking at the food compound to start modifying the genes. Even some of the antioxidant minerals will all play a pivotal role in those issues. Now, there is a very simple test. Well, how do you know what are you eating? Are you really absorbing? Okay, clearly I said antioxidant is from all your plant foods, your fruits and vegetables. It's not coming from your sugar, it's not coming from your fats, it's not coming from a slice of white bread. So the greater you consume your antioxidant, of course, your score is going to rank even higher. So there is a little simple machine, basically just measure your skin tissue. Pretty easy, top the 0.1 millimeter of your skin. Why? Because whatever you're eating within about 6 weeks will transfer into your skin. So that's what it's measuring. It's going to save a lot of money from the research ending, meaning that we don't really have to check people's blood any longer, because the skin carotenoid actually give you much more accurate reading than your serum, because serum based on your day-to-day intake, but your serum carotenoid actually measures 6 to 8 weeks period of time, okay? And almost this is like, remember years ago we checked people's fasting glucose? People, if they know that they're diabetics, they try to behave the day before they go to their doctor's office to get their blood sugar done, and finally we know. And what we're doing is that we do the glycosylated hemoglobin. What is that? We check your blood sugar through checking your red blood cells. Because your sugar attached to red blood cells, we know how compliant you are with the diabetes management in 3 months, okay? In 3 months. So those are the things, the tools that we see coming down the pipe. But when we're talking about as good as all the fruits and vegetables there is, many of my women patients, I would say, always say, have you heard the word plant-based diet, right? And as a dietitian, we keep telling our patients, eat more the plant-based food. Nothing's wrong, okay? One of the precautions for you, especially for my GYN patients, you know the surgery that's being performed. Some of you even had bowel resection. And some of you even have gone through radiation therapy. And some of the radiation therapy involves a bigger field because of nodal involvement. Okay, as good as a plant-based diet or plant foods, one of the things I caution on my patients, number one, if you had all those things done or you're just coming off the surgery, be aware of a tremendous amount of gas and bloating will cause, right? If you're not a vegetable person, you start eating a lot of vegetables, yes, you're bound to be gassy, okay? Second thing, all these raw vegetables are not very easily digested, okay? And sometimes can have a greatest potential causing partial bowel obstruction. So that's what a lot of time people come into my door. Really, I look at their surgical report. I want to know what's been done. Okay, if it's disease recurrence, then we want to work even more to prevent any of the potential bowel obstruction. So some of the things we can do is start with a well-cooked vegetable or even pulverize them. Okay, once you had a bowel obstruction, the second time that will happen can be pretty. The percentage is very high for the second time partial bowel obstruction. So always do the cooked vegetable. Always chew your food well, especially if you're eating raw fruits or vegetables. Okay, if you can't do it, just best thing is just pulverize them, liquefy them. If you have these high-power blender, because it doesn't make any difference. You eat them as a whole as well. If you eat them in the liquefied form, as long as you're eating them, you're getting the benefits, right? Okay, and sometimes I will, as a dietitian, I do use digestive enzyme. Not saying that your pancreas is not working. After rounds of chemotherapy, many people experience, I would say about 75% of patients, yes, they're constantly gassy, they're bloating because the entire gut is affected. So digestive enzyme, do some of the over-the-counter, can help you alleviate a lot of problem. Or even the most simplest one, you probably have heard, Beano. Okay, that's only dealing with one thing. But sometimes I use various different broad spectrum enzyme. And the other thing, sometimes you may even want to consider lactose-free diet, especially if you had a bowel radiation to the entire pelvic abdominal area. And the last thing, I really am a firm believer for all my GYN patients, even all my patients, to use a lot of probiotics. Whether it's organic yogurt or if you want to buy extra supplement in terms of probiotics, absolutely do that. The goal is to protect your bowel because your immune function, immune cells, about 60 to 70% are all congregated in that bowel. Okay. Now, how do we eat? If we're going to blend it together, easiest thing I tell many of my patients, just do a healthy shake, right? Almond milk, yogurt, that's your probiotics. You can blend in any kind of fruit and even put a whole handful of the kale right in there. It tastes delicious, trust me. If it's not sweet enough, just put a little bit agave or stevia. That's great. I'm totally fine with that, okay? And the other thing, this is my daughter actually asked me. I just did one of the Cancer Support Community Weekend workshop. My daughter has this friend who's really into this science and nutrition and using all the scientific tool to develop these, we call it gastronomy type of thing. Says, can you, my friend wants to know what exactly you're cooking for your cancer patient. Okay, so that day I just did a plate, and had I known I was going to show this to the public here, then I would have cleaned up the plate a little bit better. Okay, so basically what I did, and just give you an idea, what are we looking for long-term survivorship? You have small amounts. I had a wild salmon, and then this is your mango salsa, a mango papaya salsa. Why do I do that? Because sometimes the fruit has a huge amount of enzyme, help you to digest your protein better, especially the papaya. And vitamin C also help you increase some of the iron absorption. And I have roasted beets. I have roasted the kabocha, which is one of these winter, squash, that's right. I have a rosemary roasted Brussels sprouts, and this is everybody's favorite, is cranberry and sweet potato yam bake. So that was that day. Pretty much I had other things, but that was the plate that I gathered for my daughter, since her friends wanted to take a look at it. Okay, and what I'm trying to say is that how do we eat for health? Nutrition doesn't work overnight. I just wanted to have 1 sentence, 1 minute, is that to encourage you all, is that a lot of times people work on nutrition. They say, I don't see it. When cancer cell formation or the cellular genomic expression, the change in the gene expression may take 25 years, our lifespan, to cause that cellular change, immune compromised situation or inflammation, all those things play a role in our health. Nutrition is that when you start adding all the color, zeroing the color, everything you eat in the plant kingdom, color, color, color. And then if it's not enough, you want to add all your spices, herbs, everything, anything. Some people will say, what, Timmy, can I use this? Can I use that? Doesn't matter as long as herbs and spices, use them. The hottest thing right now, you probably see the yellow thing, is a turmeric, curcumin. That was also done in the ovarian study. The study wasn't conclusive, but again, depending on the dosage, depending on the length of time, we just don't know. Okay, and eating the nuts, that's a good source, very good source. If you have a hard time eating nuts, just cream it. Do the creamy peanut butter, creamy nut butter will be better than using a lot of various different oil. Good oil, olive oil, avocado is always good. Coconut, again, is in thing now. Okay, again, although it is still considered as very saturated fat, I'm not telling my patients don't use it, but I do say do including some in your cooking, because coconut oil, especially if you have digestive issue, that's great. It's readily absorbed. 70% of it does not even require GI, digestive system, directly into your system as a calorie source. Okay. If you need to gain weight, those are the things. If you need to lose weight, focus on all those foods. Okay. And the lastly, really, I think a lot of times people say, I just eat scrambled eggs for breakfast. What about add some salsa to your scrambled eggs? What about adding some what's this thing? Holiday season, we always use it. Use basil, pine nuts, that grind it up. Pesto, that's right. Hummus was another thing. So those are the things I encourage my patients to adapt for long-term survivorship, because we're looking at all these food in the long run or even short time. Just simply that carotenoid, as I mentioned, within a month, you start seeing the repairing of the DNA damage. Selenium was the other thing was done in a study for BRCA1 gene. BRCA1 gene mutation, selenium hopefully will help to repair, because I stopped that gene repair, but selenium may help repair the genes. So the goal is not just zeroed in one aspect of food, but embracing everything. So hopefully to give you the best outcome. Thank you so much. Thank you.